pamuviri. Hapana, hapana. Mai vanofanira kufane pamuviri. Hapana, hapana. Hapana, mai vanofanira zvekufa. Hapana, hapana. Hapana, mai vanofanira zvekufa. Hapana, hapana. Hapana, mwana anofanira zvekufa. Hapana, hapana. Ikodzero yedu isuve nharaunda. Hapana, nezveutano. Ikodzero yedu isuve nharaunda. Kuminira mune zveutano.
This is one of the thousands of meetings that have been conducted by locals who have been trained by staff of Save the Children and Community Working Group on Health to educate communities on the Patients Charter and to gather information on the performance of health facilities in rural areas throughout Zimbabwe. The project, which began in 2013 and scheduled to end June 2016, is covering 21 districts and is working with 66 health centers and 166 health center committees.
We are working very straightforward, and we are knowing that our advantages are these and these, and the committee will scrutinize and face all other things that are there and try to expose the problems that we have so that we can solve them.
The community feedback mechanisms include information collected from suggestion boxes, complaints through the health literacy facilitators, and community monitors who use scorecards to come up with ratings on the selected key areas.
4, 5.
The health center committees, with a wide range of representatives from all sectors in the community, including government workers and health staff, are the link with authorities at a higher level.
We are also the bridge between the health staff here at the center and the community, right? We are also there to assess whether health interventions being made in the area are making a difference.
In all the areas under this program, home deliveries, which were a major cause of mortalities during pregnancy and deliveries, are now almost at zero.
October ndobva 12 deliveries, home ndobva 0. November ndobva 20 deliveries, home delivery ndobva 0.
The XCC from Chitimbe Clinic had to go to Nakiwa and meet with the XCC for Nakiwa and see other developments which were being done by Nakiwa Clinic, and then so that we can implement those same developments at our clinic. So the waiting mothers home, as we are speaking right now, we are almost complete.
There are, however, few pockets of resistance, mainly from some religious objectors.
The gaps are there because we've got religious objectors, Matita sect, which is mainly in Gwanda South. We have actually made a breakthrough to them, though they are not all forthcoming.
Traditional and church leaders who are part of the committees are working hard to eliminate the few pockets of resistance.
Ndikufamba nchinatsa kuvatsanangurira kuti hakuna chitendero chinonzi hachikwanise kuenda kuchipatara.
Communities and authorities are worried over the pull-out by Save the Children and Community Working Group on Health, as they feel it is rather too early and that there is need to cover other health centers that have not benefited from this program.
It is a bit sad, but we hope they'll get funding. Because if we say half, we still have the other half which is not aware of or which did not benefit from the from the program?
When I look at the clinics in Makonde now, the 13 that have been under this program and the other clinics that are not on the program, you'll see that there's a very big difference in terms of operations for the nurses in the communities in the 13 clinics and the nurses in the other clinics that we didn't have the program. So I would actually urge, if funds were permitting, that we move into the other clinics so that they also benefit the same way that these other clinics have benefited.
Most of the time we're overwhelmed with work. So we wanted someone who will be reminding us, who will be working on behalf of us, coordinating and seeing to it that these activities, this program is flowing on well.
In the sense of timing, where there are now feelings or attempts to exit, it's premature in our view. This is not the time. This was the beginning of a very brilliant project. People came together. We were starting to see the progress. Various government departments would meet to solve problems. It was a peer-to-peer review mechanisms.
It was a project actually that had brought accountability, and they were even asking to say, who's going to be the referee to all this work? Meaning to say it would actually put down the gains that have been realized for the past 3 years.
Other associated partners like the WHO, they're all saying no, it's not a good time for us to actually leave because of the good work that they've seen on the ground. As well, they've realized that if we pull out at this juncture, the work that we had established is likely to go down because of the economic challenges, the other factors that will affect the voluntary workers on the ground.
HCC number one. HCC number one. Kanatashika. Vanessa Kaoma. Kanatashika. Vanessa Kaoma. Mamonita number one. Mamonita.